All right, let's jump right in. If you're prepping for your MD pharmacology exam, you already know this is a massive, heavy hitter question. The 25-mark LAQ on animal models for screening anti-diabetic drugs. You literally can't just list off a few mice and rats and hope for the best. To get those top marks, you absolutely need structure, you need those granular details, and you need to show the examiner you've got complete mastery of the pathophysiological mechanisms. So, in this explainer, we're giving you the ultimate step-by-step blueprint to write an answer that'll honestly blow your examiner away. Get ready, because we are going deep into the textbook details.
So here's our game plan. It's an exact 6-part framework. First, general considerations. Second, an anti-diabetic overview. Third, type 1 chemical models. Fourth, type 1 spontaneous and miscellaneous models. Fifth, type 2 models. And finally, genetic models.
Okay, let's kick things off with Section 1, General Screening Considerations.
Now, before you even touch specific disease models, your LAQ has to establish the foundational rules for picking a test system. Seriously, do not skip this. Examiners are always looking for students who know the why before the what. So start your answer by listing 3 core factors: animal, test, and drug. To make it super easy, just use the mnemonic ATD, animal, test, drug. For the animal factors, you got to consider the strain and baseline pharmacokinetics. For test factors, you're asking, is this model sensitive? Is it reproducible? And for drug factors, you're looking at what background PK and PD data we already have. Kicking off your essay with ATD just proves you're thinking like a real pharmacologist from sentence 1.
Moving right along to Section 2, Anti-Diabetic Models Overview.
Take a good mental snapshot of this exact classification table from your textbook. It divides models into chemical, spontaneous, surgical, and miscellaneous categories. Look, this is literally the core skeleton of your essay. When you sit down for the exam, draw this out as a massive flowchart. If you recreate this tree, splitting into type 1 and type 2, and then branching out into chemical, spontaneous, and miscellaneous methods, you've practically secured a passing grade before you even write a single paragraph. Now, let's actually break down the exact details you'll need for every single branch.
Which brings us to Section 3, Type 1 Chemical Models.
All right, so this is our first major subheading, the chemical induction of type 1 diabetes. Basically, this is all about destroying those pancreatic beta cells. You'll want to use the rule of threes here and memorize the mnemonic SAD. SAD. That stands for streptozotocin, alloxan, and dithizone. For STZ, you absolutely must mention that it's a nitrosurea derivative isolated from Streptomyces acromeganes. For alloxan, don't just say, we give them alloxan. No, tell the examiner exactly what we do. Take a Wisterat, weighing 150 to 200 grams, and inject it subcutaneously at 100 to 175 milligrams per kilogram. It's those specific tiny details that turn a decent LAQ into a flawless one.
And right here is where you can show off your knowledge of mechanistic differences. STZ is fundamentally a broad-spectrum antibiotic with oncogenic and diabetogenic properties causing direct toxicity. But dithizone? It is so cool and totally unique. It's an organosulfur compound that chelates zinc right inside the liposomes of the beta cells. When it does that, it releases protons, triggers massive osmotic stress, and literally bursts the insulin granules from the inside out. Nailing that specific mechanism on your paper is a guaranteed way to score huge points. Oh, and whatever you do, do not forget this highly specific number, 65. Specifically, 65 milligrams per kilogram. That's the exact intraperitoneal or intravenous dose of alloxan you need to produce diabetes in mice. Remember how a second ago we said rats need 100 to 175 milligrams subcutaneously? Well, mice are a whole different story. 65 milligrams per kilogram, IP or IV. Write it down, underline it, highlight it in your brain.
Let's shift gears to Section 4, Type 1 Spontaneous and Miscellaneous Models.
To really show the breadth of your knowledge, you have to go beyond basic chemicals and cover spontaneous, surgical, and immunological pathways for type 1. Putting this miscellaneous section into a quick table format on your exam paper is a super smart move. For spontaneous, you have the NOD or non-obese diabetic mouse. Make sure you mention that hyperglycemia shows up between 12 and 30 weeks of age. For surgical methods, note that we actually remove 70 to 90% of the pancreas. Immunological uses guinea pig anti-insulin serum. And for viral, drop the name Coxsackie B4 virus. Tell them it destroys the acinar cells, but initially leaves the adjacent islets of longer hands intact, which then eventually triggers an autoimmune response.
Now for Section 5, Type 2 Models.
Okay, so the absolutely crucial point when you transition to type 2 models is that you have to emphasize insulin resistance combined with partial beta cell function. You aren't just obliterating the pancreas anymore, you're trying to mimic human metabolic syndrome. I highly recommend replicating this exact matrix to clearly separate the 3 main STZ protocols for type 2. Yes, we're using STZ again, but we tweak the recipe. First, there's neonatal STZ, where we give 100 milligrams per kg to a one-day-old pup. Second is the NAD STZ model, where we administer nicotinamide before the STZ. And third is the high-fat diet model. You give a tiny dose of STZ, just 30 milligrams per kg, and feed them a diet of 20% sucrose and 10% pig lard for 4 weeks.
And here's a pro tip. Dropping a highly specific stat, like the 40% preservation of insulin stores in the NAD STZ model, proves you have deep textbook mastery. Explain the why to your examiner. Nicotinamide acts as an antioxidant. By giving 230 milligrams per kilogram of it about 15 minutes before 60 milligrams per kilogram of STZ, you're scavenging free radicals. This protects the beta cells just enough, saving exactly 40% of their insulin to create an adult rat that perfectly mimics non-insulin-dependent diabetes mellitus. It's brilliant. To round out your type 2 section, you'll want to list these alternative chemical models. We've got a great mnemonic for you here. MAG. MACG, that's MSG, atypical antipsychotics, corticosteroids, and gold thioglucose. Be sure to point out the stark contrast to your examiner. For example, MSG causes diabetes without polyphagia, meaning the animal isn't eating excessively. But gold thioglucose? That causes massive hyperphagia and severe obesity. For corticosteroids, they stimulate gluconeogenesis. And for the atypicals, just cite olanzapine at 10 milligrams per kilogram for 60 days.
Finally, we arrive at Section 6, Genetic Models.
This right here is the high-yield climax of your LAQ. This is where you seal that perfect 25 out of 25. This table is basically the ultimate cheat sheet for your brain. You need to clearly separate the OB mouse, the DB mouse, and the Zucker rat. Think of it like this. OB stands for out of leptin. It has a mutated leptin gene, so it's leptin deficient. DB, on the other hand, stands for defective receptor. It produces leptin just fine, but the receptors are mutated, making it leptin resistant. And then the Zucker fatty rat has a mutation in the FAD gene, making it leptin resistant too. You've got to get these genetic defects mapped out correctly.
Now pay attention, because this is a classic examiner trap. They will definitely check to see if you know the difference in blood sugar between the deep mouse and the Zucker fatty rat. The deep mouse gets severe hyperglycemia super early, leading to serious complications like diabetic nephropathy and ketosis. But the Zucker rat, despite being a textbook model of hyperinsulinemic obesity and insulin resistance, its actual blood sugar levels usually stay totally normal its whole life. Pointing out that specific paradox shows you truly understand the nuances of these models.
Conclude your list of genetic strains by throwing a spotlight on the Goto Kakizaki, or GK rat. This one is incredibly important because it's a highly unique, non-obese, inbred Worcester strain with peripheral insulin resistance. It's a great counterexample since so many type 2 models rely on massive obesity. The GK rat doesn't. Also, quickly mention the ZDF rat, the Zucker diabetic fatty rat. Unlike the standard Zucker we just talked about, this genetic cross actually does develop severe hyperglycemia, hitting up to 20 millimoles per liter.
As you wrap up this massive essay, you want to anchor your conclusion by zooming back out. Give a nod to the overarching purpose of all these preclinical studies. Remind the examiner that we need this massive array of models, everything from the precise chemical destruction of STZ all the way to the genetic quirks of the DB mouse, because diabetes is an incredibly complex, polygenic, multifactorial disease. There's literally no single animal model that perfectly replicates the human condition. And that's exactly why a diverse, multi-model screening approach is absolutely vital for discovering new anti-diabetic drugs.
So before you walk into that exam room, you have to test yourself. Can you write out this entire structure entirely from memory? Do you have every dosage, every gene mutation dialed in? Can you list the ATD considerations, use the ADD mnemonic for type 1, the MACG models for type 2, and accurately contrast the OB and D mice? If you can master everything we covered today and memorize those doses, you aren't just going to pass that MD Pharma LAQ, you're going to absolutely dominate it. Happy studying, and we'll catch you in the next explainer.